All right, next we're briefly going to talk about the adrenergic agonists or catecholamines. So catecholamines, example of these are your dopamine, dobutamine, and epinephrine. So these medications are often used for patients who are acutely and critically ill. So often this is to really increase their blood pressure and at times their cardiac contractility. So this is used in cases of hypotension or severe hypotension or really low blood pressure and heart failure. So also remember that an adrenergic agonist is another example of adrenergic agonist is epinephrine, and epinephrine is also used for allergic reactions or anaphylaxis in the form of an injection. And so know this. I mean, it's very short, but this is very important to know. And also keep in mind that the butamine, dopamine, and epinephrine, this can mostly be seen in the ICU as an IV infusion. So you guys don't really have to administer it, but just so you know that the patients can be on these medications to increase their blood pressure if your regular PO or oral medications are not as effective. And know that epinephrine, although this can be used for very low high blood pressure, this is also used for allergic reactions or anaphylaxis. All right, let's briefly talk about the drugs used for dysrhythmias. So dysrhythmias are basically abnormalities in the heart rhythm. So this is when we look at our electrocardiogram, which is a way to look at the electrical activity of the heart, right? So this is when there's a disruption of the regular rhythm and it's basically out of order. So it can be irregular, it can be basically abnormal for the patient. So there are drugs that we give for when the patients are having dysrhythmias. And so first, let's look at the classification of antidysrhythmic drugs. So this is the Vaughan-Williams classification. So they are class 1, class 2, class 3, class 4, and then we have our miscellaneous or others. So for your class 1 antidysrhythmics, you have the fast sodium channel blocker. So this is your pharmacological class, and these are your prototypes. So for the class 1A, you have quinidine and procainamide. For class 1B, you have lidocaine and mexiletine. And for class 1C, you have flecainide and propafenone. So these medications, so class 1 antidysrhythmics, are usually used for this type of dysrhythmias. So atrial fibrillation, atrial flutter, and ventricular tachycardia. So memorize this, the whole thing, this table. Highlight it, right? Put an asterisk next to it. Anyhow, moving on, the next class of antidysrhythmic drug are your class 2 antidysrhythmics. So class 2 antidysrhythmics are beta blockers. So prototypes or examples of these drugs include esmolol, propranolol, and sotalol. So see these suffixes, right? So they sound quite the same or similar. So they end in lol. So these medications, the indication include tachyarrhythmias, atrial fibrillation, and atrial flutter. The next class of antidysrhythmic drugs include the class 3. So in class 3, this is your potassium channel blocker. So that's the pharmacological class. And examples of these medications or prototypes of this class include amiodarone. So you have to remember that medication specifically, dofetilide, dronedarone, ibutylide, and sotalol. So these medications are often used, especially your amiodarone, for atrial fibrillation and atrial flutter. Now, these medications can also be used for ventricular tachycardia and ventricular fibrillation. The next class is your class 4, so they are the calcium channel blockers. So examples of that include verapamil and diltiazem. So these are commonly used for atrial fibrillation and atrial flutter. And you also have other medications. So an example is a nucleoside, which is your adenosine, and this is used for supraventricular tachycardia. So this is really a rhythm that's really, really fast, that's coming from somewhere above the ventricle. And then another medication that we also use as an antidysrhythmic is atropine, which is an anticholinergic, and this is used to treat bradycardia. So when the heart rate is very, very low, and usually when the patient is symptomatic, now because there are patients that don't really need atropine if they're not having symptoms. So if a patient with low heart rate starts experiencing low blood pressure, dizziness, chest pain, or any other symptoms, then we can say that that patient is symptomatic. So when a patient is symptomatic, we usually give them atropine, which is an anticholinergic to treat that dysrhythmia. Last but not the least, you're probably familiar with this, is your digoxin, which is a cardiac glycoside, and this is often used for atrial fibrillation, which is a type of dysrhythmia. Now, as you know, this is also used for heart failure. So again, digoxin has different purposes. So please memorize this table